My name is Lena Hall. I'm the family nurse practitioner student, and I'm doing the second part of my neuro assessment, which is coordination, motor system, muscle flex, muscle strength testing for upper extremities and lower extremities, muscle strength testing for and sensory system special tests and deep tendon reflexes. Do I have your consent?
Yes.
Okay. So first we're going to test the coordination, and we're going to do the upper extremity. I'm going to do the rapid alternating movements and point to point movements. So first I'm going to have you strike your hand on your thigh and turn it over like this. Okay, other side. Okay. And then I'm going to have you take your hand and you're going to meet your finger with your thumb. Okay, up and okay. Now for this test, I'm going to have you touch your nose and then touch my finger until I tell you to stop. Okay, now we're going to test the lower extremity. I'm going to do the rapid alternating movements and point to point movements. So I'm going to put my hand down and have you tap on my hand. Okay. Okay, now for this part, I'm going to have you put your foot on your ankle and slide up to your other side. Okay, good. All right, next we're going to observe the patient's gait. So I'm going to have you walk across to the end of the couch, and I'm going to be observing for your posture, your balance, your arm swing, and your leg movement. Go ahead. And then on your way back, I'm going to have you walk heel to toe. Okay, good. Now I'm going to have you walk on your toes. And on the way back, walk on your heels. Okay, now I'm going to have you hop in place. Okay, and hop on one foot. Hop on the other foot. Okay. Okay. Now I'm going to observe your stance. I'm going to have you push your feet together and hands on by your side and close your eyes. And I would have you stand here for about 20 to 30 seconds and observe your stance, your posture. Make sure that you're not swaying. And now we're going to do the pronator drift. So go ahead and put your arms out. And this will be the same for about 20 or 30 seconds. There's no drift observed. Okay, go ahead and put your arms down. You can take a seat. Now I'm going to start with the motor system. Throughout all of this assessment, I would already been observing the body position during the movements and at rest. And I would be observing for tremors, tics, vacillations, and so I'm going to have you put your hands out. No tremors and no tics. Go ahead, place your hands down. Now I'm going to be inspecting the muscle size and contour, and I would be noting any atrophy, and I would be doing a close inspection on the hands as the patients are getting older. Look at the shoulders. Look at the thighs. No atrophy observed in any of the areas so far. I would assess the muscle tone, and I'm going to be looking for resistance. Lower extremities and on the feet. Okay. Now we're going to move on to muscle strength testing. So for the upper extremities, I'm going to take your arm. You're going to flex for me, and I'm going to pull on your arm, and you're gonna push against it, okay? Now push on it. Same thing on this side. All right, +5 on both bilaterally. I'm going to do it now. Push on my wrist. Okay. Okay. +5 on the wrist. Go ahead and grip my fingers. Okay, thank you. And now I'm going, that was testing the grip strength, and that was +5. And now I'm going to be doing the finger abduction. Push on my finger, push against it. Okay, same on this hand. Okay, strength is +5. Now I'm going to test the thumb. You're going to push your thumb inward against my hand as you, there you go. Same here. All right. And that is testing for the upper body. Now we're going to do the lower body. I'm going to test the hips flexion and extension. So go ahead and push up on my hand. Okay, same here. Okay. Push down. Push down. All right. Now I'm going to test for the hip abduction and adduction. So I'm going to place my hands on the outside of your legs, and you're going to push against my hands. Okay, and on the inside. Good. Strength is +5. Now I'm going to test the knees. So go ahead and push on my hand. Okay, push away. Same on this leg. Push on my hand. Okay. Now for your feet, push up. Push on my hand. Push up. Okay, good. Push on my hand. And push. All right. +5 in your lower extremity. All right. Now I'm going to test for the sensory system, which I'm going to test for the light touch. So when you feel the light touch on your skin, do you feel that?
Yes.
Let me know. Say yes, okay?
Okay. Yes. 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 Yes.
Okay. And the precipitation position, I would grasp the great toe, holding it by its side, and move the toe up and down, up and down several times, and then pause and have the patient identify the position. So you will identify if the toe is up or down for me.
Up, down.
When I pause.
Up, down.
When I pause.
Up, down. Up, up, down.
Okay. Okay. Next we're going to do the deep tendon reflexes. So I'm going to start with the upper extremities and the biceps. So the with your palms down and your thumbs over your biceps tendon. I'm going to straight. And then I will try the triceps. So while the arm is supported by knee, take a deep breath and relax. Okay. Take a deep breath and relax. Okay. And then the brachiolateral, 1 to 2 inches from the wrist. Okay. Next, we're going to be doing the lower extremity, which is the knee jerk. So I will be tapping at the patellar tendon just below the patella. And then I will be doing the dorsiflexion, so I will be striking above the Achilles tendon. Okay. And then I can do the Bobinski's test on your foot. I will be sliding a tool down your foot, and if the toes fan out, that's normal. If they curl under, that means it's a normal test. Feel that?
Yeah.
All right. And that is